Dr. Bauer, what was the impetus for doing the study? What were you hoping to discover?
Well, Mark, if we can think about stress in healthcare and especially what do physicians and nurses experience, whatever it was before COVID, if we want to think of that as a crisis, I think that's a fair terminology, right? Doctors were burning out, nurses burning out. If that was a crisis, then COVID took us to whatever comes after crisis, catastrophe, or take your pick. So I think really the impetus of the study was what else can we do to help our colleagues, our friends survive and preferentially actually thrive, even in the midst of everything that's going on. So the idea was, is this another tool? Could the breather fit, could a respiratory muscle training actually help our colleagues do better in the midst of everything that's going on in the healthcare environment today?
Describe the protocols of the study. What was the most significant finding?
Well, first of all, the protocol was pretty basic because again, we've got really busy healthcare providers, right? Doctors and nurses. You can't give them a huge, complicated protocol and say, do 40 minutes of this, 2 hours of that, and see if it reduces their stress. You're not going to be very successful. So the idea is, can we give them simple things that can be impactful? And here the protocol was pretty basic. 5 minutes of training with the breather fit in the morning, 5 minutes of training in the evening, and then some basic resiliency training ideas in between, some education, some coaching, pretty basic, but with the idea that hopefully that would impact things like stress, anxiety, sleep, depression. So that was kind of the goals of the studies, kind of how the study was set up. We did standardized measurements, things that are recognized as gold standard measures. We measured them at baseline, and then again at the conclusion of the study 1 month later. What were the outcomes? The outcomes were pretty impressive. It was a very short study, a very small study. We had 10 physicians who participated in this study. So it was really more of a feasibility or a pilot study. It wasn't a huge study, but even with a small study, we saw very positive outcomes in terms of reduction of stress, about an 18% reduction in stress. So that was pretty impressive given the small duration of the study and the small size of the study. Didn't see a huge reduction in depression, not much impact on sleep, and we didn't see a huge improvement in resiliency. But again, these physicians all started out with pretty high resiliency at the outset. So I didn't expect much of an improvement. But again, this is also a unique population. I suspect we'd see a different outcome if we started with individuals who maybe had lower resiliency at the outset of the protocol. But the key thing, I think, was, did we impact their stress levels? That was really the main hoped for goal, and we did achieve that despite all the limitations of the small study.
Did anything surprise you about the study? What was there one finding that you took from this over other findings that, like, wow, I did not know that was true?
I don't know if it surprised me. I think it reassured me that these busy physicians could find 5 minutes twice a day to do a pretty basic respiratory muscle training and actually get a pretty significant impact on their anxiety or stress levels. So I sort of would expect that to happen, but it's kind of reassuring when it does. And when you think about it, 5 minutes twice a day, it's still asking a lot in these busy clinicians' lives, but it's doable. And they showed that when we asked them, was it worth doing this study? Almost all of them said yes. Would they recommend it to another colleague? Almost all of them said yes. So I think we're on to something. When we can bring something relatively simple to the whole picture, right? We still don't think this is the whole answer. We still believe in the benefits of nutrition and exercise and good sleep and other mind-body practices. But as we're looking to expand that toolkit of how do we help our colleagues not only survive, but thrive in this day and age of incredible stressors, this was very positive. One small tool, but it had a very big impact.
What doors would you say this opens for follow-ups and perhaps additional studies?
Well, no question, it was a small study, right? So only 10 physicians. So we can't say too much about, does it apply to other types of physicians who weren't represented in the study? Can we apply it to nurses or other healthcare providers? The answer is no. I think that's a great question, though. We know nurses are probably under even greater stressors right now, especially those working in the hospitals. I think that's a population that needs every bit of help we can find for them, or try and bring to the table for them. So I'd love to see us take these results and look at nurses as specific populations, therapists, pharmacists. I mean, anybody who's trying to help patients in the healthcare industry right now, everybody's suffering. And we're losing clinicians right and left. People who are old and have the opportunity are retiring early, cutting hours. That means some of the younger folks who are looking to those gray hairs to help be guides and mentors, we don't have guides and mentors for them. And so younger folks are taking on those leadership roles and taking care of complicated patients that they're really not totally ready for, but they're being asked to jump in, which is only accelerating their stress levels. And how can they then be ready to help for it's a very worrisome time. And I think we really have to bring everything we can to bear to try and help them survive what looks like a ongoing crisis, or really a catastrophe of huge proportions.
What do these findings offer in terms of the general workforce? This is outside of healthcare. This is corporate America. How can this help people get back to work faster if they have been out from COVID, or they just want something to have more resilience to be prepared?
Well, I think you had a very important point, Mark. The idea of resilience is not unique to healthcare providers. Resilience is something we all need. So whatever your job, whether you're a CEO or a stay-at-home mom trying to homeschool your 3 children, we all need more resilience. And I don't see that becoming less going forward. Looking at the challenges, even post-COVID, it seems like there's new challenges coming every day. How do we not only survive, but I think more importantly, thrive? And to thrive, we really do have to enhance, to optimize our health. And we can only do that if we really are thinking about all aspects of health. And part of that is resiliency. And to build resiliency, we need to be focusing on things like mind, body, physical health, exercise. And here we get to this idea of, could something like Breather Fit, with this idea of respiratory muscle training, be part of that? And so the answer is, I think, yes, because almost anybody can do something like this, whereas not everybody can engage in aggressive aerobic training for a variety of reasons. Some people find mind-body training challenging. I like the idea of meeting people where they are, regardless of what they're trying to get back to in terms of their work, but having different tools for different people. So I've had good success with a lot of the executive patient side coach using something like Breather Fit, where they probably weren't quite ready to go out and start doing meditation. Some jump for meditation and love it, but having those different opportunities, I've had really good success making different options available to meet people where they are in their health journey.
Well, Dr. Bauer, this was very insightful and helpful, and it was a great study, and we just want to thank you for your time.
Well, Mark, thank you very much. I look forward to doing some more work with you in the future as well.